Hello guys, welcome back. So we are going to continue with the questions from Mr. Brook in the anatomy. And before watching this video, I would highly suggest that you watch my previous video. The link is in the description box. Okay, so let's begin. So in this question, they are saying that it is in the right hand. The sensitivity is lost in the lateral part of the hand and on the dorsal surface, and also the proximal phalanx of the first, second, and partially third fingers. Which nerve has been damaged? So first of all, you should know that the basic anatomical position of the hand is like this. If this is the medial, that is towards the body, then this will be lateral. You can't do hand like this and say, okay, this will be the medial. No, the anatomical position is like this. So this will always be the lateral. You don't want to confuse yourself by changing the position of the hand. Keep the hand position same. And now see what they are saying. They are saying that the lateral part of the dorsum of the hand, like this part, the sensitivity is lost on this part, and also in the proximal phalanx of the first, second, and the partially of third finger. Okay, so now let's move to the let's talk more in the detail, that is about the radial nerve. So radial nerve is the thickest nerve of the brachial plexus. It is the thickest nerve of the brachial plexus. And its root value is C5 to T1. And again, if you want to know what all of this means, that I'm suggesting you to watch my previous video. And now let's look for its course, as it is it goes from axilla, then enters the upper limb, and then it is present in the lower triangular space. Then it is present in the radial groove, or also called the spiral groove, that is present on the posterior surface of humerus. That is present on the posterior surface of humerus. Okay. So now when it enters to the forearm, then it enters the forearm, and then it is divided into basically two terminal branches, that is the superficial and deep. The superficial runs in the anterior forearm, and the deep, the deep branch first gives off some branches. We'll see to which muscles in few minutes, and then after placing the supinator muscle, it then is called posterior interosseous. This is a simple pathway of radial nerve. It is the thickest nerve of brachial plexus. The root value is C5 to T1. It is given off in axilla. There it gives some branches. We'll see. Then it is present in the lower triangular space. Then it is present in the spiral groove. So out of all of these, the most important is the spiral groove of the humerus, on the posterior surface of humerus. So then it enters a forearm, and there it gives two branches. These are the terminal branches. These are what? The terminal branches. And it gives the superficial runs to the anterior forearm. The deep, after piercing supinator, becomes a posterior interosseous, and then it goes to the posterior forearm. Okay. So now let's look at this scheme. I've made it so that it becomes easy for you to understand. So first of all, again axilla, then it enters the arm, that is, it is present on the posterior surface of humerus. Then it is in the forearm, and then it ends in the wrist. So there's a very common mnemonic of radial nerve. Okay, I'll write it here. That is okay. That is the best. That is the brachioradialis, extensors, supinator, and the triceps. So why was it made? Because these are the muscles that you should never forget. That is the extensors, triceps. These triceps is basically the extensor of the arm, and these are the extensors of forearm. And the supinator, that radial muscle, is also for the supination. Now, okay, so apart from that, we're also, these are the name of all the muscles. The muscles which are written in green, these are for the motor, and the things that are written in blue, it is for the sensory supply of radial nerve. So an important aspect is that the radial nerve gives motor branches to triceps brachii before it enters the radial groove. That is, the motor nerves to the triceps brachii is given before it enters the radial groove. That is in axilla, basically in axilla. Then in arm, that is on the posterior surface of humerus in the spiral groove, it gives off muscle to the enconius brachioradialis, extensor carpi radialis longus. So I have written all the short forms. It's up to you. If you can remember, great. And if you can't, just remember all these important the best mnemonic. Okay, then it enters elbow, and I told you that here it gives off two terminal branches, that is the superficial and the deep radial nerve. So the superficial branch is basically sensory, is a sensory nerve. It only gives a sensory supply to the skin over anatomical snuff box, that is right over here, and also the lateral surface of dorsum of hand, again lateral surface of the dorsum of the hand, and lateral, this is the lateral, this is the medial, lateral 2.5 fingers, basically the proximal parts only. And I'll show you that in photo in just a minute. So again in the forearm, and here it gives the deep branch. The D branch is a motor nerve. It supplies to the extensor carpi radialis brevis and supinator. And after it pierces what? Supinator muscle, it becomes posterior interosseous nerve. So the posterior interosseous nerve supply all these muscles. Again, it's up to you. If you want to remember all this, it's great. Otherwise, it will not be asked in the Krok, at least. I'm just giving you a quick overview, or maybe like a detailed overview. So, and also the sensory, the posterior cutaneous nerve of arm, this branch is again given off in axilla along with the motor branch to the triceps brachii. Then also posterior cutaneous nerve of arm, it is given off in the arm. That is where will be it? In the spiral groove in the posterior surface of humerus. Okay, so now if I ask you, okay, if there is somewhere, however, there is a problem in axilla. For example, in this, for example, in the Saturday night palsy, however you want to call it. Saturday night palsy, and also crutch paralysis. So what about these two? It's like anyone who is drunk, he's sitting on a chair with arm over the edge of the chair. And also, for example, in crutch, when you hold the crutch is in your axilla. It is sitting under your axilla for a long period of time. And you know that in axilla, the radial nerve is there. It is the thickest nerve, and it can be damaged here. So when there is a Saturday night palsy or crutch paralysis, the radial nerve is damaged somewhere here. So here there will be loss of extension. Then it will also be called, there will be wrist drop. Like the wrist will be dropped, you can't extend. So it will stay like this. That is just termed as wrist drop. And also there will be sensitivity loss of sensation. Okay, in the whole arm, in the posterior surface arm, posterior surface of forearm, and all over the areas supplied by the radial nerve. But okay, so if there is damage in the arm, that is, if there is a damage in the posterior surface of forearm, that is fracture of humerus. So tell me, will be the extension of arm affected? Well, not really, because the triceps brachii is not paralyzed, because the motor branches to triceps brachii were given off in axilla, and now the problem or the damage to the nerve is where? In the humerus. So the triceps brachii will be spared in this case. It will, maybe there will be partial weakness, but it will not be paralyzed. All other muscles will be paralyzed. Okay, so now if there is somehow damage to forearm, again there will be a problem in extension. So here again, so what will be the symptoms? Wrist drop and sensory loss. And now again in the forearm, the triceps brachii is spared because the motor branch is given off in axilla. So here also the symptoms will be the same. There will be present wrist drop and also sensory loss. But keep in mind, the sensory loss will only be of this area. These sensory branches are already given in arm and axilla. So the posterior surface of arm and forearm will be the sensitivity here will be fine. The sensory loss will only be in this area. And now if somehow there is damage in the dorsum of the hand, there will only be what? Sensory loss. Okay, because the motor branches are already given off in forearm. And here also the sensory loss will be this. That is in the dorsum, the lateral surface of hand, and proximal phalanx of the first, second, and half of third finger. Okay. Again, this was the question. Now let's see very carefully. And this is an image of right hand. Now, so take your right hand and just imagine that this is a medial surface. The one shown in light blue, that is the medial surface, because I told you anatomical position, you see your hands like this. So the medial 1.5 fingers is supplied by ulnar nerve on the palmar as well as the dorsal surface. But the one in the dark blue color, that is the area supplied by the medial nerve. Again, palmar surface and the lateral 3.5 fingers, but also the distal phalanx of the same 3.5 fingers. Now, if you look at the radial nerve, that is given in purple, it will be only be on the dorsal surface of hand and up to the proximal fingers of first 3.5 fingers. So just keep it in your mind, look at the image, imagine it on your hand, and now let's look at that question. So again, this was the question: lateral part of the dorsum of the hand and proximal first, second, and partially third finger. So what will be the answer? The answer will be the radial nerve. Okay. Okay, so I found two more questions related to this concept. So let's study. So the first question, number 96. After a fracture of upper third of the humerus, the paralysis of posterior group of muscles of shoulder and forearm developed. And what is fractured? The humerus. Which nerve was damaged? So the answer is obviously the radial nerve. Why? Because first of all, the nerve, this nerve is in the posterior surface of on the posterior surface of humerus in the spiral or the radial groove. Okay, so this was the point that was hinting towards answer. And also the posterior group of muscles. So the posterior group of muscles are nothing but what? The extensors. And you all know that the extensors, like the triceps brachii, which is the extensor of the arm, and all the other extensors of forearm, they are supplied by what? The radial nerve. Okay. So next question. This one was similar to this other question, number 98. Okay. So after a trauma in the site of the shoulder, a patient cannot extend a hand. Examination has also shown a decrease of pain and temperature sensitivity at the site of 2.5 fingers. Come on, let's do it. 2.5 fingers of the hands on the dorsal surface from the side of the thumb. Okay, so when you are reading the question, just imagine it and just go along how the question is saying. So 2.5 fingers on the dorsum of hand means 1, 2.5, and from the side of thumb. So basically the lateral surface. So yeah, so this was the dorsum, the lateral surface, and the 2.5. So obviously here also the answer will be what? The radial nerve. Okay. So we were doing question number 98. So let's move on to the next question, question number 99. A man of 45 appealed to a clinic complaining of sensitivity loss in the back third of the tongue, the function of which pair of cranial nerves was affected. So let's study the tongue, its nerve supply. Okay, so the tongue, it can be divided into the anterior two-third and a posterior one-third. So the anterior two-third are developed from the pharyngeal arches number 1 and 2. And if you know about the pharyngeal arches, you know the 1 and 2, they give rise to the nerve number 7 and the 5th. So the cranial number 7, that is a facial nerve. It has a branch which is called the chorda tympani. Very important nerve, you should remember its name, chorda tympani, and it is for the taste. Okay, so for the taste on the anterior two-third of the tongue is by chorda tympani of the facial nerve. And the other sensation, that is pain and temperature sensation, it is by the lingual branch of the fifth or trigeminal nerve, or that also the third, that is the mandibular. So again, the pain and temperature or the any other sensation, it is by the lingual nerve of the mandibular branch of the trigeminal nerve. Okay. So this was about the anterior 2/3. Now, if you go back to the posterior 1/3, the posterior 1/3 is developed from the arch number 7 and arch number 3 and 4 of the pharyngeal arches. So again, but here both the taste and the pain and other sensations are by cranial nerve number 9, that is the glossopharyngeal nerve. Now, so yeah, here again, as this is the photo of I got this photo from the first aid book of step 1. So basically they have divided the taste and the sensation, so it is easy to understand. So the taste in the anterior 2/3 is by what? It is by the chorda tympani branch of the facial nerve, and in the posterior third it is by what? The glossopharyngeal nerve, and in the extreme posterior, until and unless they haven't written the extreme word, don't choose the vagus nerve. If they have written the posterior, so always go for what? Glossopharyngeal nerve. And here the sensation on the anterior 2/3 is by lingual branch of mandibular branch of trigeminal nerve, and the sensation is again on the posterior 1/3 by glossopharyngeal nerve, and in the extreme posterior it is by the vagus. So you can see that they have drawn what? Epiglottis here. So okay, another thing that you should know is that the line demarcating the anterior 2/3 and the posterior 1/3 is nothing but your valid papillae, and they come in the posterior 1/3. So if I ask you what is the nerve supplying the valid papillae, that will be what? Cranial nerve number 9, because it is a part of posterior 1/3 of the tongue. This was a question asked in Krok, but I couldn't find the questions, but you should remember this as well. Okay, so this was about the taste and other sensations. So let's go on to the muscles of the tongue. These are the extrinsic muscles. There are 4 muscles mainly: hyoglossus, genioglossus, styloglossus, and palatoglossus. So all the other, these are supplied by cranial nerve number 12, that is the hypoglossal nerve, except for this one, the palatoglossus. It is supplied by vagus nerve. So let's also write the functions of each muscle. So the hyoglossus retracts and depresses the tongue. It what? Retracts and depresses. The genioglossus, it protrudes the tongue. Styloglossus, it raises the sides of the tongue. So when it raises only the side, a furrow is created. This is just the function of styloglossus. I remembered it like the stylo means S, it raises the sides of the tongue. And palatoglossus, it raises the posterior part of the tongue so that it can touch the soft palate, and it helps in swallowing. So there was a mnemonic given in the step 1 that genie, you know, genie, Aladdin, when you rub the pot and the genie comes out. So again, genie comes out, so genioglossus helps in protruding the tongue out. Okay, so now let's write it here. The taste is by which nerves? Cranial nerve number 7, the chorda tympani branch. Cranial nerve number 9, glossopharyngeal in the posterior 1/3, and cranial nerve number 10, the vagus, in the extreme posterior. And all this, the nucleus in the brain is the tractus solitarius. This is a sensory nuclei. So the pain. So in anterior two-third, it is by lingual branch of trigeminal nerve. Again, in posterior one-third by glossopharyngeal nerve. And in the extreme posterior, it is by the vagus nerve. And the motor, it is mainly by the hypoglossal nerve, cranial nerve number 12. But also one muscle is supplied by the vagus nerve. Which muscle? The palatoglossus. So let's discuss other questions that are related to this topic. So this is again from the ministry book, the anatomy part, question number 28. A patient has a tumor in the brainstem area and has a difficulty with putting his tongue forward. Again, what is it asking? The protrusion of tongue. So what tongue muscle has been affected? Oh, sorry. The genioglossal muscle. Again, Ginny, when you rub, Ginny comes out of the bottle, so genioglossal helps in protruding the tongue forward. So next, a patient has a tongue motor function disorder. Which nerve was injured? Here, since both hypovagus and hypoglossal nerves are given, go for hypoglossal because mainly all the muscles are supplied by the hypoglossal. Even the palatoglossal, it is it is also supplied by some parts of hypoglossal nerve. So go for hypoglossal nerve. So next question number 137. After an oral cavity soft tissue is injured, a patient lost gustation, it means taste, in the posterior third of the tongue. So yeah, the gustation means taste, and in the posterior one-third means the glossopharyngeal nerve. And this is for taste in the anterior one-third. Okay, lingual nerve was for what? Lingual nerve of trigeminal nerve. So this was for basic sensation, pain and etc. And hypoglossal was motor. When you choose a question, always see why other options can't be the answer. Okay, question number 140. During the initial examination of the patient does not have general sensitivity on the anterior two-third of the tongue while gestation is preserved. So, okay, let's read this. Gestation is by cranial nerve number 7 and general sensation in the anterior two-third. They are not talking about the posterior, otherwise both of them will be by what? Glossopharyngeal. So anterior two-third is by what? Trigeminal nerve, and that too, its lingual branch. So here, like in this option, they are saying the lingual branch of trigeminal nerve after its conjugation with chorda tympani. So let's see. Let's imagine this is the lingual nerve, and this is the chorda tympani branch of the facial nerve. So this will go to tongue to the anterior two-third, right? So they are saying lingual branch of trigeminal nerve after its conjugation. See, if the damage is here after its conjugation, so obviously not only lingual but also the chorda tympani branch will be affected. So the taste cannot be preserved then the taste will also be affected. Now, let's see other chorda tympani of facial. Again, they are saying that the general sensation is affected, not the taste. So this will also not be the answer. Glossopharyngeal nerve. They are not talking about the posterior one-third. They are talking about the anterior two-third. So this will also be not be the answer, not the sublingual. So let's look at option number A. Lingual branch of trigeminal nerve up to its conjugation with chorda tympani. So basically they are saying that it is not conjugated with chorda tympani yet and it has a lesion. So yeah, in this case the taste will be affected, but the the sensation will be affected, the pain and temperature general sensation will be affected, but the taste sensation will be preserved because it has not yet conjugated with the chorda tympani, and so the taste is preserved. So that's it for this topic.